protocol for the management of psych, psych, psychiatric patients with psychomotor agitation. Abstract. Background. Psychomotor agitation, PMA, is a state of motor restlessness, and mental tension that requires prompt recognition, appropriate assessment, and management to minimize anxiety for the patients and reduce the risk for the escalation to aggression and violence. Standardized and applicable protocols and algorithms can assist healthcare providers to identify patients at risk of PM, achieve a timely diagnosis, and implement minimally invasive management strategies to ensure patients and staff safety and resolution for the episode. Methods. Spanish experts in PNA and PNA from different disciplines, psychiatrists, psychologists, and nurses, convened in Barcelona for a meeting in April 2016 based on recently issued international conscious guidelines and on standard of care for psychiatric patients with PNA. The meeting provides an opportunity to address the complexities in assessment and management of PNA from different perspectives. Attendees work toward producing a consensus for a unified approach to PNA according to the local standards of care and current local legislations. The draft protocol developed and was reviewed and ratified by all members of the panel prior to its presentation to the Catalan Society of Psychiatry and Mental Health, Spanish Society of Biological Psychiatry, and the Spanish Network Center for Research in Mental Health. For input, the final protocol and algorithms were submitted to these organizations for endorsement. Results. The protocol presented here provides a guidance on the appropriate selection and use of pharmacological agents, seclusion, and physical restraint for psychiatric patients suspected of or presenting with PNA. The protocol is applicable within the Spanish healthcare system. Implementation of the protocol and the constituent algorithms described here should ensure the best standard of care of patients at risk of PNA. Episodes of PNA could be identified early in the clinical course, and patients could be managed in the least invasive and conservative manner, ensuring their own safety and that of others around them. Conclusion: establishing specialists in agitation and providing them with continued training on identification of agitation patterns and management and therapy alternatives may reduce the burden of PNA for both the patients and the healthcare system. Keywords: naloxone, psychomotor agitation protocol, verbal escalation, physical restraint. Background: psychomotor agitation, or a state of motor restlessness and mental tension, is associated with a variety of psychiatric conditions. May be evidenced by an increased motor activity and emotional activation, but may also be accompanied by emotional lability and decreased level of attention and alteration in cognitive function. PNA is particularly prevalent in among the schizophrenia and bipolar and disorder population, In Spain, a recent report indicated that 25% of patients with schizophrenia and 15% of those with BD could be expected to suffer at least one episode of PNA each year, with a median of 2 episodes per year per patient. Emergent PNA requires timely recognition, appropriate assessment, and management to minimize anxiety for the patients and reduce the risk for escalation to aggression and violence that may be directed towards the selves or others. Episodes of PNA may be encountered in the context of impacting psychiatric facilities, but also in the emergence on sitting and outpatient clinics. Recent studies suggest that up to 10% of all emerging psychiatric interventions are related to PNI. Consequently, inadequate identification and management of PNA is an essential component of the care of patients with psychiatric disorders, as agitation is understood as a continuum of symptoms ranging from mild to severe. It is essential to detect episodes of PNA in their earliest manifestation to avoid a possible escalation of symptoms. Ineffective management of PNA may result in the unnecessary use of coercive measures, involuntary medication, physical restraint, and seclusion that could potentially precipitate aggression or violence. Moreover, delayed or inappropriate management of PNA might lead to an increased use of hospital resources and avoidable hospitalizations, significant economic costs. International expert consensus recommendations have been recently published for the assessment and management of patients with PNA due, due to their primary psychiatric condition. However, there is lack of standardized protocols and clinical tools to assist clinicians and healthcare professionals in achieving the best possible outcome for patients presenting with episodes of PNA. Against this background, we aim to elaborate a protocol developed for the assessment and management of patients with PNA. The key difference with the original consensus article is that it was a broad compilation of all the available bibliography on the topic that may not be always easy to apply to the daily clinical practice. Legal protocols have to be based on the current and high degree evidence literature. However, an adequate and adapted guidance to all the healthcare system is not always achieved from the literature perspective. Because of that, despite the current protocol is based on the same information of a recent critical review of the literature, it is made to provide specific guidance for the care of patients presented with an agitation episode adapted and specific, and not only to be close to clinical practice, but also to be in accordance to the Spanish healthcare system. When used in the clinical setting, this protocol would reduce the anxiety of the patient, ensure the physical safety of both patients and HCPs, and minimize the risk of escalation to aggressive behavior and violence by means of a series standardized actions. MEDACs. This protocol presents in the application and adaptation of recently published international consensus guidelines on the management of psychiatric patients with PNA. The methodology consists in a search of the most prevalent articles, a systematic review according to the GADAT scale and according to the PRISMA statement criteria, and consensus among different international experts. expert on the topic of PNA using the Delphi methodology. After this international consensus was present, many authors decided to lead a new specific panel of experts in their own country to seek applicability of this protocol according to the Spanish mental health police and laws, using the guidelines as a foundation and internet standard operating procedures from the hospital clinic and provincial de Barcelona and panel of Spanish mental health professionals with relevant experience in clinical guideline development and or in systematic reviews. Research methodology was the comment expert committee that consists of 8 psychiatrists, 2 nurses, and psychologists who were organized into sub-panels based on their expertise. The purpose of the panel was to provide expert advice during the development process. A core group was established to design the protocol and provide more time-sensitive and operational advice according to the local policies and national laws. The core group also developed a multi-step process that included an assessment of citing of the clinical guidance, semi-structured interviews, a Delphi international consensus survey, an external review with official national mental health scientific societies. A first round of possible evaluation and treatment recommendations, the evidence upon which they were based, and the adequacy for the implementation in the Spanish healthcare system were reviewed at a meeting of the expert panel in April 2016. Subsequently, draft recommendations were prepared by the subpanels, which were circulated to the entire group for consensus. Throughout 2016, once preliminary recommendations were agreed by the expert panel, an external review was requested to the Catalan Society of Psychiatry and Mental Health, as well as the Spanish Society of Biological Psychiatry and the Spanish Network Center for Research in Mental Health for input and endorsement. Other recommendations included in the protocol. The protocol is presented in 3 main sections. The first section covers the initial identification evaluation of a patient presenting with a suspect of PNA, including assessment tools and differential diagnosis guidance. The second section covers recommendations for selection of appropriate interventions during an episode of PNA, including environmental modification, risk escalation, pharmacological treatment, and physical restraint. The third section details evaluation that should be undertaken following an episode of PNA. In addition to these main sections, 3 clinical algorithms have been developed to provide easy and quick guidance and a main recommendation of the protocol in relation to the initial and general management of the patients with PNA, the selection of appropriate pharmacological interventions, and standards of care when physical restraint is needed.